So Vicky, if you don't mind, please take the floor and tell us all about what this new project is and how we can help.
Okay, thanks very much, Tui. Good morning, everyone. Yes, in the newsletter, there's lots of details about it. We've just released a new song called Respect, which is very much about trying to change the conversation and is about rebranding the people, not the virus. Looking as people as the solution. So we're shooting a video over the next 2 weeks, which is going to be the main footage is going to be done in Gambia and the Americas. But what we would love is to also have images and short video clips from around the world so that it's truly global and inclusive, because we want this song to mean something to people irrespective of age, race, gender, wealth, sexuality, geography. So it really means something to everyone. So what we're looking for are small, just either images or video clips of a COVID rocks. And a COVID rock are those people who are making personal sacrifices for everyone's good. Or it could simply be you and a group of people vibing to the tune. So that's what we want. It's a real feel-good song to keep people going during this time. People are trying very hard, and we want them to keep trying hard because we're not over it yet. So it's a feel-good song, really nice vibe to it. The link and everything is in the newsletter, and we'll include it in the chat as well at some point. So that's what it's about. So please do send stuff. It's by next Sunday, so that's the 21st of March. We need those images, those videos, and obviously if it's to someone else, please make sure you have their permission before you send it to us. And I think that's about it. So we're looking for, it's a call to all those COVID rock and rollers. So I know it's a bit early to be talking about things like this, but that's what we're after. So thank you.
Thank you so much, Vicky. That's great to hear. And also, if you don't want to send anything through, but you have connections that can help spread the word, please, would also love to hear from you as well. So without further ado, David, welcome. Are you all connected?
Yeah, thank you very much indeed. Just struggling a little bit with the internet. How great to meet with everybody today. And once again, I've got quite a structure that I want to go through, and I want to share with you what we've been doing with the media this last week, and invite you to comment. I'd like to look straight away at Sheila McRae, who I can see right next to me on the screen, and greet you along with Marianne. And want to just say to everybody, Sarah McFarlane as well, thank you, that this is a really special group of people. And during the session, I will acknowledge everybody. Now, I'm going to start by talking about the pandemic, and then I want to talk about the vaccine situation. I'm going to go into an analysis of responses and some global issues as well. And it's been quite a lot of media interest this week because for various channels, it's been 1 year on from the declaration of the pandemic, has been an important peg for news. And so what have I been saying in response to people asking me 1 year on, what have we learnt? Here it is. So we must expect this virus to go on spreading with spikes and indeed surges as long as there are susceptible people in populations. There is nothing happened that has stopped the virus from behaving in that way. Lockdowns do freeze the virus in place, but they don't get rid of it. The only way you get rid of the virus is through isolating people with the disease for long enough, and so that they either die or are ill and get treated, or do not have illness at all, but they must not pass the virus on to other people. So the way you stop spread is through detection and isolation, and there is no other way of doing it. So as lockdowns are released all over Western Europe, we will get a rapid upsurge in numbers of cases. The upsurge could be at least as big as what was seen in Europe during the end of 2020. and beginning of 2021. I am being clear that this is what I expect. I'm not using words like I am concerned or I am frightened. I'm just saying it is to be expected. And why am I saying that? Well, look at what's happening in Eastern Europe right now, in the Czech Republic. There you've got really a big uptick in numbers of cases and hospital overload. Look at what's happening in parts of Italy. They're the same parts of Germany. It's just has been happening. It's calmed down a bit. The reality is that you will go on having spikes and surges as long as there is virus. And just because it's declining in one place doesn't mean it's declining everywhere. And so again, there's an uneven story in the United States with some areas that have got increases, some areas that have got decreases. It's all happening at the same time in the country. In Canada, the same, but there's a particular piece of information from British Columbia where there's been an outbreak in a vaccinated residential care home with a variant suggesting that a vaccine escape has happened there. And we are obviously looking out for more situations where vaccine escape is occurring. In Brazil, what was a really terrible situation in Amazonas has now become a really difficult situation in Sao Paulo. And why is Brazil so bad? Answer, because there's an awful lot of virus around in the country. When you've got an approach to the response that is really saying it's not much of a problem and is working against efforts to try to limit the spread of the virus, all that happens is you just get an awful lot of virus in various different parts of the country and it will surge. So possibly Brazil is the major Latin American hotspot, but the boundaries between Brazil and Colombia and Brazil and Ecuador are still difficult spaces as well. In Africa, there are some countries which are experiencing extremely difficult COVID situations right now. I've talked to you about Southern Africa before, West Africa now, some parts of Eastern Africa and Somalia and Kenya also experiencing difficulty. Again, it's location specific, it's not everywhere. And it's quite hard to explain to those who want to comment on this that the virus doesn't spread in waves like flu. It spreads with spikes, often with quite narrow diameters, and then surges that build up if the spikes are not dealt with. And then if you've got a really big surge, the virus appears to swirl around and form explosive outbreaks that overload hospitals. And so I'm trying to understand more about these patterns and trying to be able to explain them. But overall, I just keep saying this pandemic is continuing to move and it will go on moving. And it's really important that nobody perceives that it's either nearly all over or going to be all over. Now, the variants will go on coming, and we're wondering whether there are particular people who are more likely to harbor variants with mutations, particularly in the spike protein on the virus. We are wondering whether people who are treated with immunosuppressive agents or other drugs that influence the functioning of the immune system are more likely to be places where variants emerge. It's all a hypothesis at the moment as to what are the conditions of variant emergence, and I shall continue looking for that. The need to constantly improve testing capacities and sequencing capacities is there, and that means that my constant request is for investment in diagnostics, but investment in smart diagnostics that potentially will have the opportunity to distinguish quickly between variants. It's not impossible. On the vaccine rollout, I think that everyone reading the papers gets a pretty clear idea that it's become a competition in Europe between leaders as to who can preside over the most rapid vaccine rollout, with a bit of a row last week, once again, between the European Union, the President Charles Michel, and those in the UK and others. And it's a sort of potency thing, who's got the best ability to get the vaccine out quickly in their country is the leader who will command the most votes. And I suppose I understand that. And as somebody who wonders about my own vaccine status, I can see why this has become a defining characteristic of Western European political leadership at the beginning of this year. But truthfully, it's still a really awful mess. I mean, if you were doing the vaccination by any kind of logic, you would use your vaccine in response to the level of need, and you would go for health workers first and then to most senior citizens. And yes, there will be a delay, and people in their 40s and 50s will not be vaccinated for some time. But naturally, there is a huge buildup of demand on politicians to get vaccines. So we've got supply problems for many vaccines, just batches that go wrong in the manufacturing, as I've mentioned before. We've got constant anxiety about whether or not there are side effects from vaccines. I suspect there's a little bit of misinformation there as well. There's a story about AstraZeneca being associated with clotting disorders and deaths in 2 instances recently. And my own line is, you can't assess vaccine safety on the basis of sporadic death reports, because, I mean, people die, as we saw from Norway. There were deaths of people who'd been vaccinated, and it was concluded that they died anyway. But inevitably, if you get reports of a few cases of people dying after vaccine, that can easily stir up an anxiety. And I'm really, really nervous about misinformation in relation to vaccines. So I'm not personally in a situation where I would say that the side effect news of this last week should lead to changes in strategy. I rely on regulators. I think regulators know how to deal with adverse effect reports. And so I'm basically personally wanting to encourage people not to start discriminating between vaccines, not to start saying, I want Moderna or Pfizer, but I don't want AstraZeneca. I don't think there's a case for that yet. On certification, I continue to be nervous about the use of vaccine certificates for travel purposes, because that will create a market in fake travel certificates and fake vaccines. And I've mentioned to you last week, and I'm continuing to say that I want certificates, but for public health purposes, not for travel purposes. So let's just look around the world at what the messages are on how to respond. You know, first of all, how serious is COVID in the world? I mean, there's a collective lack of willingness by political leaders to really come out clearly and say this is still a problem. And I'm not quite sure why, because not only is it a problem, but there are a number of features of the evolving COVID situation that are really a very big worry. For example, in some European countries, with the increase of immunization of older people, protecting them. So who ends up in hospital? Well, it's younger people with COVID. I mean, just that is what's happening, because older people are protected. So it is said in France that the age of COVID patients in hospitals is decreasing, and it's reported similarly from parts of the UK. So and at the same time, we've got schools going back. So what is the right strategy for dealing with COVID now? And it is continuing with the personal protection of physical distancing, mask wearing, isolation when you're sick, hygiene, protecting those who are most vulnerable by shielding and by vaccination. And then there's the second part, which is supporting all this through honeycombed community level public health services with strong local engagement from local authorities. And I will continue along with WHO colleagues making this point that without public health and without personal behavior, this will go on causing high levels of death, basically with surging infections, really until the majority of the world can be immunized with effective vaccines. So keep going on the personal protection, and be super careful with setting all these dates when somehow things will be over. Why is the US calling for 4th of July to be Independence Day from the virus? There is not going to be independence from the virus in the US for a long time, because there's just so much virus around. And I'm very, very keen to also support people in countries where leaders deny that there's a problem, whether it's Brazil or Tanzania, and I'm particularly concerned in Tanzania because of the rumors that the president himself has COVID and is actually being treated in a Kenyan hospital, which is all quite bizarre. On the global response, I just want to say that I think that the Tedros position in WHO has been rock solid. He's not shifted. And then I've just listened to Maria Van Kerkhove on Sanjay Gupta on CNN, just making all the points that I've just said, but doing it much more eloquently than me, saying this is just not going away and we have to continue. In a session I had with Imperial College academics yesterday, I was asked, where's the good news, David? And I said, the good news is that we can hold the virus at bay through non-pharmaceutical interventions, and that this is being done very effectively in many countries throughout the world, and that in Europe, there's a lot of learning going on. I was told that's not good enough, good news, and that I needed to be ready to shift my narrative to how the vaccine will end the pandemic, at least in the countries that have got high levels of vaccination. Well, I'm not prepared to shift to just a constantly optimistic message based on stuff that I think is potentially false. You know, the vaccines will not bring us out of the pandemic unless there's extremely high coverage with a combination of immunization or people who've had COVID who've got antibodies. And if we start pretending that with, say, a 33% adult vaccination coverage, that should lead to a reduced incidence, there is something very surprising about population immunity in relation to this pandemic. So I will continue to say non-pharmaceutical measures until at least the end of 2021 and probably into 2022 in most parts of the world have got to be maintained, and that is the only way, when we support them with good public health services, that we will be able to avoid seesawing into yet another lockdown in Western Europe and further lockdowns in other parts of the world. It is an absolute priority to learn to coexist with this virus without using lockdowns as the primary means of control. And that's because of the evidence that increases, partly because I'm talking with people in countries all over the world at the moment because of my food work. There is just no spare capacity in the majority of countries in our world today to do further lockdowns and to go on using government cash to provide income support to people who are caught up in the effects of lockdowns. And so because there's very little fiscal space in the majority of national budgets, particularly in poor countries, what's likely to happen, as I was hearing, for example, in Madagascar yesterday, the country has gone into lockdown, but it's not clear for how long there will be capacity to provide income support for the people who've lost income because of the lockdown. And so there is a real possibility that with the continuing advance of the pandemic, that we will get lockdowns imposed without the income support and social protection measures that are so necessary. And then what happens, as I've said before, and I've said it this week, big time in my media work, it just widens the gap between those who have and those who don't have. And that's just really not what we want to happen as a result of this pandemic. I'd like now to invite Twee to give us just a little bit of our half-time moment. And then with the help of Catherine and colleagues, I'd like to invite everybody to make comments and to react on any of these points. And so I will go round and please don't hesitate to come in if you've not been on one of these sessions before and commented. Just open up your microphone and wave or so, and then we can have a bit of a conversation. Over to Twee for our mid briefing moment.
Thank you, David. All right, I'm launching the poll now. So you'll see on your screen a window pop up with 3 questions. So I'll read them out and you follow along with me, and please answer as we go along. So the first question is, which condition increases the likelihood that COVID-19 will lead to serious consequences and is harder to prevent with movement restriction measures? Sleep apnea, obesity, or arthritis? The second question, GISRS, and I'm just going to call it GISRS. I'm not sure if that's the correct way to say it as an acronym. GISRS has integrated SARS-CoV-2 in its work to monitor viruses and diseases, assess epidemic and pandemic risk, and inform development and update of vaccines and control measures. What does GISRS stand for? The Global Influenza Surveillance and Response System, Group for Informative Science and Reporting Status, or Global Integrated Security Response System? And then the last question, going along the exercise path that I've been going down recently, is which stretch would you like to try today? Thumb stretches, hand stretches, or neck stretches? So while you're responding to that, I would love to show a spotlight of the illustration that Chris has been doing so far. Welcome, Chris. Everyone, Chris is kindly scribing live from Live Illustration UK. Chris, how's the drawing been this morning? Any loving that honeycomb? What has been your favourite draw so far?
Yeah, no, I think I'm a bit behind schedule. I've got loads of notes to go with it. But yeah, I've got my horrible COVID character in there, spiking and surging.
Fantastic. Well, thank you so much. And I hope all is well with you in the UK.
Yeah, I'm about to post a question into the chat as well, which can be digested and maybe replied to if there's time.
Would you like to ask it now?
Well, okay, yeah, no, I will, because, like, you know, obviously in the UK at the moment, you know, the schools are back, and I can't emphasize what a big change of life that is. And I know that we're in a very nice first world country with all the mod cons, but I think everyone is generally still quite traumatized anyway from the last year. And, I think it's bizarre. There's this sort of festival atmosphere, basically. I mean, I think, like, in terms of a national narrative, as far as everyone's concerned, it's practically over. Schools are back and we'll be in the pub by June. And, it's almost unshakable. And so when David was saying there's going to be a third wave, I think people are living in sort of blissful ignorance. And I'll be very interested, because you will get shouted down almost immediately if you say, oh no, we shouldn't be doing this, because everyone will say, oh well, we'll be vaccinated by the summer and everything will be fine. So based on this, the last 30 minutes, it seems that might not happen. So I'm very intrigued to get a bit more detail.
Thank you very much, David. I'll leave that to you, but before I do, I will share a little bit more about the poll. Let's see what you've responded. So indeed, 100% of you had question 1 correct, obesity. It does increase the likelihood that you will suffer serious consequences from COVID. And of course, it's harder to prevent when we have movement restrictions. There's a report released recently from the World Obesity Federation, I think it's called. So we can share that in the chat as well. A very, very interesting report about the latest research on that. Gizriz does indeed, you're 72% correct, global influencer surveillance and response system. It's a very interesting framework that's set up, including a very fascinating funding model where the industry funds it, and then the industry can use the information that comes from it. And there's a great review about how that's integrated the SARS-CoV-2 work into it this week in the World Health Organization Epidemiological Weekly Update, which I can also share. And then lastly, which stretch would you like to try today? Let's do some neck stretches. So just rolling the neck round. So we'll go nice and slowly, clockwise first, like this, and then anti-clockwise, nice and slow. In 3, 2, 1, round, and then anti-clockwise, back again. So it's okay, we've got our video on today because we're doing it together, but if you're on a video call and you do feel a little bit stiff, you should just turn your video off and make sure you get that movement across all of the different parts of your body. All right, thank you very much. That is the end of our little intermission trivia. Back over to you, David.
Oh, great. And it was lovely to do that neck. I had it go click twice, and I feel that something nice has loosened up. I'd just like to say, Sheila, would you like to come in, Sheila? I haven't seen you for a bit, and I wonder how things are going. And you've written something in the chat, so why don't you come in?
Oh, David, thank you very much. That was very interesting. Yes, Marianne told me about these sessions, and I'll be able to join the fortnightly Friday morning ones, not the alternate Fridays. But well, I've just written it up with typos as well, but asking you why the variants are being called the Kent variant or the Brazil variant, which doesn't seem to be very informative, and also has a bit of almost criticism, recrimination on why has Kent gone and got this variant? So it doesn't seem, are they developing one upon each other, or are they each developing separately and newly, quite independently from each other? That was my main thought.
Thank you, Sheila. My understanding is that the variants do develop quite independently. They're named after the place where they were discovered, but that's not necessarily the place where the variation happened. The WHO have got a group trying to develop nomenclature for variants in an effort to stop the use of either a country name or a location within a country as the way in which they're described, but that's not working. The habit of putting a name on a variant seems to have built up and is used sometimes to disparage places. And nobody likes that. But what we're learning more and more in all this is just because something is good from a public health or global perspective doesn't stop things happening just because there is an absolute love for stigmatizing around this disease and being able to basically score points between countries. So in France, where I live, Sheila, I notice how often the variant that has become dominant in the early part of this year in the UK is referred to as the English variant. It's not the Kent variant, it's the English variant. And it fits into the sort of narrative of slight frustration with England and then more than the UK for all the Brexit stuff. So there's a real delight, a political delight in using the geographical appellations, and it's a frustrating thing to us. Particularly the way in which the South African thing has been used to make some pretty unpleasant remarks in public about that part of the world, as has the Brazilian one. So let's see. I think perhaps the habit will go away as more and more variants come on stream, and we will get a better nomenclature. But the alternative nomenclature of referring to the place where the mutation has occurred, like B117 and so on, that's not going down too well either. So perhaps it'll be like they do for hurricanes, where they go alphabetically through names.
Yeah.
I'll let you know anymore. Thank you.
Thanks. Nice to see you. So many years since our India missions.
Yeah, it's gone the past. Thank you. I wanted to ask Stephanie Okoyo, are you here still?
Hi, David. Yes, I'm here.
Yeah. I wanted to give you a moment. I appreciate your internet probably doesn't allow you to join in video, but how are you? And there are a few people on from Nairobi, including yourself. And I've just been talking to colleagues in Kenya this morning. I'd be really interested to know how your life is, and because it's some months really you've been living under quite difficult circumstances. Stephanie, please.
Thank you, David. It's a pleasure today to meet, to be able to join this session. So far, here things are, we are still on lockdown. Not on lockdown, but on curfew. So we still have curfews 5 to 11 o'clock. But people are now, it's become a normal thing to wear masks. And we are business as usual. I have to say, people are frustrated now with the restrictions that hinder business. But we did have our first shipment come in for the COVID, for the vaccines last week on Tuesday. But there isn't the spirit of being able to get the vaccines, because we do know before it goes, the normal citizen gets it will be some time. So people are not so hopeful in terms of getting the vaccine, and that's the air around it. And also there is a lot of miscommunication on the vaccine. And I feel that's now the main communication barrier that public health sector will have to deal with, or people working on this area. But so far schools are opened, and I must say the education sector is really trying in terms of trying to stick to the physical distancing, masking, and washing. And I think one of the good things that has happened is there's been more effort with the wash practices within schools particularly. So you'll find schools that had water problems, that had sanitation issues, now has become a national agenda.
Really?
Yeah, so far that's the situation here. But I think with the vaccine, it's not the same narrative. If you compare with Western Europe, and talking to other colleagues, is the vaccination program seems real to normal citizens, but for us here, I think by the time it trickles down to someone like me or even my grandmother will be some time. Yeah.
Thank you, Stephanie. I find myself really tuning into, we're getting on with life. Masks are worn, and in school, it's water and sanitation has become a priority because of COVID. That is really, for me, that is really interesting news, and is a silver lining to the cloud. Thank you very much indeed. Can we go on with colleagues who are in Kenya and ask Jo Nichols if she wants to connect? Jo, you texted me this week, and it was both about issues in Somalia, but also issues in Kenya. Be lovely to hear from you, building on what Stephanie just said, if you like. And if Miles would like to come after Jo, if that's relevant, that would be lovely as well. Jo, please.
Thank you. I think one of the things we've been discussing this week at work has been about the predictability of the batches of vaccination that will be brought in. And I understand that globally it's only really possible to have kind of a 7-day forward-looking pipeline, but that does cause some challenges, especially when countries are deciding, whether to use it all up in one go, or whether to wait and do the second dose for people. And I think, the other issue that has come up, and you touched on it also with the media about the president of Tanzania, is the politicization of all of this in a variety of different countries, and also the fear that vaccinators and people involved in vaccinations in some countries, especially where there is already conflict, might well be targeted. There was a situation just a couple of days ago in Mogadishu where a vehicle was attacked, and immediately the reaction was great concern about whether or not it was linked to the people who will be using that kind of vehicle in the future as vaccinators. So, and sometimes I feel like we're so keen to focus on the science aspect of it that we don't necessarily focus on the political dimensions of what's happening.
I know answers to what you've just said, but really, really interesting. First of all, information about dispatch from COVID and the predictability of knowing when a new batch of vaccine will come. I think this is an absolutely massive problem globally, and relates to the reality that there are problems with production from time to time. And now each time a batch has to be discarded because the production process was somehow failing on one or more of the safety indicators, that in turn causes a knock-on difficulty downstream because there's just so little buffer in the way of stocks right now of any of the vaccines. As soon as they're produced, they're whisked out and put onto transportation and got to a destination where people are waiting to be vaccinated. So that means that if there is any kind of glitch in the supply side, that comes through to you and you have a problem. I must say, I am going to lobby the WHO again. It'll be my third effort to say that COVAX probably needs to be expanded so that it's more than a supply program, but actually there needs to be the beginnings of a global COVID immunization program, like we've had a polio program and like we had a smallpox program some years ago, because there are too many moving parts of these complex systems that can go wrong. And part of me thinks that they'd be less likely to go wrong if there was a more coherent programming of it. But it may well be that everything I want is politically just not going to work at the moment. Your other point about politicization of the vaccination, vaccinators possibly being targeted, I think that's kind of inevitable. But what we need to be clear on is how to pick up warning signs of that sort of thing, and then how to balance the desirability of security cover for vaccinators on the one hand versus trying to make this whole effort transparent and accessible and not shrouding it in secrecy. Of course, as soon as you have to start doing security cover for vaccinators, you also have to have secrecy around their movements, and that will create all sorts of problems. So, Joe, I want to keep in contact with you about both those issues and trying, thinking. I'll also talk to Tedros and team about whether or not we could have a quite serious discussion about safety and security for people involved in vaccine administration, because it's a kind of issue that if you don't look at it and consider it, then it will never improve. Whereas, you could look at it and consider it and decide there's not much you can do, or you can look at it and consider it and decide there's a lot that you can do. And based on the experience of polio immunization, particularly when there was a bit of targeting of vaccinators, I think there's much that can be done. So, Joe, I will follow up on both of those. Thank you for bringing them up. Is there anything else, Joe, that you want to talk about? In the past, we talked about the problem of oxygen supplies in Mogadishu hospitals. Has that improved or not?
It's still a problem. There are some temporary solutions, and probably it will take both some governance changes eventually, but also some additional equipment that's being brought in, and combined, they should be able to provide sort of additional help for people. Yeah.
Thanks. And oxygen is tricky because it's another of these systems issues. You need to be able to have lots of different components of the system in place. So I can understand why you talk about governance in there. Thanks very much. My colleague Catherine Deland is on, and she is helping with a partnership to try to improve access to oxygen. Catherine, if you want to come in at any point on anything, just unmute yourself and dive in, if you don't mind. Yusuf, I would, you've made the point about the political difficulty of focusing on indefinite vigilance against COVID. But at the same time, as you say, it's really important to support policymakers to remain steadfast. It's not the first time that the position taken by the public health community has been perceived to be slightly working against individual freedoms and fun. We had it with crash helmets on for motorcycle passengers. We had it for seat belts in cars, and we had it over condoms at the beginning of HIV. So I am just interested in Yusuf having a moment to reflect on what are the ways in which us as individuals or the wider society can support policymakers. You may have 2 or 3 views on that. And you said you'd got a question on vaccination strategies and immune escape. Yusuf, you have the floor. There you are.
With your permission, David, I'll start with the question because I'm very concerned. Both what you referred to with in the Canadian situation with immune escape, and also a report that I read yesterday concerning a medical department of one of Israel's hospitals where 4 members of the medical staff who had received the vaccination all contracted the disease.
Yeah.
After immunization. I have obviously the variants, and I've read a report that there's more than 3,000 of them by now.
Yeah.
Obviously the variants are playing a role, but I also have a real question regarding the strategy of protecting the most vulnerable. Obviously, that's necessary both to protect the most vulnerable, and in a way I'm in that group given age, but also and also to protect the hospitals and the health system. But on the other hand, when you have the virus, this amount of virus, and it's accessible to compromised immune systems, doesn't that give the virus a greater opportunity to replicate and mutate?
Yeah.
And if that's the case, shouldn't we also be balancing vaccination regimes, not only with the most vulnerable, but also strengthening the strongest, so we have a more balanced approach?
Mm. Okay, I'm not enough of an expert on the strategy for vaccination in relation to immune escape, but I have been talking to some of my virological gurus who tell me that that sort of consideration needs to be taken into account. But Yusuf, I'll have to follow up with you bilaterally. It needs more exchange between us for me to understand. So I am not able to answer that question. If anybody else has a view on what Yusuf just said, please put a note into the chat and we will follow up. Yusuf, do you want to mention your other point, please?
It's basically just a point that I think we all have to be aware of, that we have to strengthen policymakers and politicians who do take the correct stand, and we have to strengthen them because it's not a popular issue. People have fatigue over testing, over restrictions, over lockdowns. Everybody wants to get back to the previous order, which is, I don't think, going to happen. And somehow we have to strengthen the decision makers to remain steadfast.
Yeah. Well, thank you, and I totally agree. And this is what WHO people are really trying to do, is to offer the best possible backbone for public health actors who have to fly in the face of a lot of derision because of what they're saying. Thank you. John Atkinson, I was just wanting to invite you to come in with a comment, and if you want to pass it on to anybody else, that would be good. And I'd like to go after John to Iman, and then we will go on with some of the points that Chris Shipton has put into the chat. I'd like to know whether Magen is still on, because if she is, oh, she's gone. I was going to give her the floor. So John, please.
I was just picking up, David, on Chris Shipton's question that he spoke out loud, as much as his comment in the narrative. And then, of course, it's echoed by what Yusuf says. And when we live in a political system that's democratic, we forget at times that leadership isn't a popularity contest. That because our leaders rely on a popular vote to get elected, we think that's what it's all about. And yet, if we do voice an opposition to the perceived view, and in UK there's very much a sort of, well, maybe it's all over, or it is all over view, you tend to be shouted out, and so you do need to be heard. But my experience is that there are many people who are not part of the supposed popular view. There are many people who are still anxious, and there are many people who are rather cautious. And so my approach has always been to choose not to pick arguments, but to focus cautiously and sensibly and forward-lookingly, if that's an English word, on what needs to be done. What can we do, rather than the hypothesizing about what will be and what won't. And to hear Stephanie say, hygiene and water become important messages now, because of COVID. Hygiene is important everywhere and will continue to be. I think many people will continue to be very cautious, even in the UK with its levels of vaccination, until they see what happens.
Yeah.
And so we shouldn't be shy of just maintaining what we've tried to do from the start, which is wise counsel rather than popular position. And if we can hold on to that, I think that's probably the right.
And it's great, wise counsel. Thank you, Iman. Then Catherine Deland. Iman, please.
Hi, David, and hi, everyone. Thank you for the opportunity. I have 2 points to share. One is about the variants and how much this is increasing and growing in Ontario in Canada. Ontario is one of the highest provinces in terms of cases, and as of today, we have around 1,200 or approximately 1,300 or a bit less total cases, and out of these we have 900 of the variant first discovered in the UK, and we have less of the variants discovered in South Africa, followed by the one in Brazil. But the variants are growing in number and dominating. The age of hospitalization is now much younger.
All right. Got that too.
Yeah. That's alarming. All public health doctors are concerned, and the numbers of death are, I mean, the picture overall is not improving greatly, despite we have been beyond the gray lockdown, which was a full stay-at-home order for nearly 3 months now. And only at the beginning of this week, we have been brought back to the gray lockdown, which is also the highest of the multicolor scale. Yet still, there isn't great improvement. People in authority positions are counting on mass vaccination.
I heard that too, Iman, that the lockdown efforts in Ontario have not brought the numbers down to the level that the government was expecting. Yeah, must be very difficult.
My second point, thank you, David. My second point is I just want to share an experience with John regarding the oxygen issue. I would like to share our experience in supporting the health system in Sudan. Sudan has a totally destroyed health system, and COVID has complicated that. And we have a chronic problem of lack of oxygen in major hospitals. What we doctors in diaspora or immigrant doctors have done is to support installation of oxygen systems in strategic locations in the capital and in outside the capital, in main hospitals in the provinces. This has made a good impact in terms of how people are able to, doctors are able to respond to cases and so on. And we did it from scratch, from doing the assessments, and it was very dynamic. Teams inside the country doing the assessments, and teams outside soliciting, doing the procurement, some colleagues following the shipping in these difficult situations, and then technicians, engineers, and everybody helping with the installation. I think it was marvelous. We did in Al Gadarif Hospital. We did in Niala Hospital in Western Sudan. These are very far locations from each other, so we're strategically placed. And in the isolation centers in the capital Khartoum, and we are continuing to do that.
Well done.
We're currently our group in Canada is supporting Wad Madani Hospital. Our colleagues in the UK did Al Gadarif. Our colleagues in America did Niala, and it's going. And I'm really proud of that experience.
So I'm only going to just say this is superb. Thank you very much, Iman. Let's hold that one as a wonderful story. Diaspora gets oxygen to these hospitals in quite tricky areas, particularly in the West as well as in Khartoum. Thank you, Iman. We're tight on time. Catherine, I did say I'd like to hear from you, but Megan has just lit up her video. Let's be, because I asked Megan before. Megan, just very quickly on Botswana, then Catherine, then Twee. Thank you. And you're muted a bit. In fact, you are muted, just so you know, Megan, if you can hear me.
Okay.
Yeah.
Hi,
Cool.
Thank you, David. Can you hear me now?
Yeah, beautiful. Yes,
Oh,
yes.
okay. I was saying numbers keep on increasing, but we're still sanitizing, practicing all the safety measures. We actually received vaccines this week, but unfortunately, people are reluctant to take it because they ordered AstraZeneca, and with all these stories coming up, so the government is still mute on what they are going to do. So we don't know whether they are going to vaccinate health personnel as advertised, because some of the health professionals are reluctant to get vaccinated. So I think maybe by next week we'll know what's going to happen, but they ordered quite a lot. Botswana is quite a small population, so it would be very easy to vaccinate almost all people over 40, but then there's too much talking going on. So we'll wait and see. I'll notify you as
please. And the talking sometimes comes in a bubble and then it calms down. And I wish I could say anything in either direction on this controversy, but right now we just have to hold it and see how it evolves. Thank you very much, Megan, for that update. And I hope you're getting used to the new way of life. It must be quite tricky from what you described.
Yeah, we're using to it. We are getting used to it, but we are so full of anxiety. Because if you go out and you come back, you wonder whether you have been infected or not, because you have to go out at some particular time.
Yeah, of course.
Yeah, due to some work commitments or going for grocery shopping. So it's quite daunting.
Okay, I thank you for your courage in telling us. Daunting. I hear various things. Some people say the longer they go on for sort of protecting themselves, the more scared they get of even going to the supermarket. So that's the daunting part. And then the longer it goes on for, the less interaction they have with other people, the more they feel they're also shriveling as human beings. So it's sort of daunting and disorienting. So we're with you, and thank you for joining us. Shifting quickly to Catherine, you did such a lot in this week. And is there any 2 or 3 quick snippets you would like to say before we move on to Twee?
I think the only one that is useful, maybe 2 things. One is, Youssef, in your question of ordering vaccines, I think my understanding of it, though, as David mentioned, we'll do some research into it as well, is that when the vaccine is super well known and the virus is really well known, it's much easier to set a schedule for what a reasonable approach to vaccinating is. Weakest to least, to strongest, youngest to oldest, things like that. Right now, we don't even really know how long vaccine-derived immunity is going to last. And so it isn't clear how to partition this out. And so I think right now the decision that's being made is, how do we reduce mortality the fastest? And that, I think, is why the question of vulnerability is come up as the sort of key one. But we'll look into it. I just wanted to let you know we have been thinking about this for a while. That's it.
Okay, wonderful, Catherine. To Twee, please.
Thank you. So we can see, let's spotlight Chris's beautiful illustration. It looks nice and complete. Some keywords brought out there. Chris, any words on your illustration today? You're on mute.
Oh yeah, no. I just hopefully I've caught you. I always run out of room. There was a whole load of stuff at the end that I didn't squeeze in. But It's great to be here as always.
Thank you so much. It looks brilliant. I look forward to sharing that further. So thank you all for joining. We'll be back next week. Our afternoon sessions, will be shifting them from 4 p.m. Central European time to 5 p.m. So that's 1 hour later than we've previously planned. In any case, please do make sure you're subscribed to our newsletter so you get our reminders 1 hour beforehand. We also have our LinkedIn community chat where you can keep this conversation going. Any questions or links you put there are really helpful for us as we prepare for the next session. I think that's it from me. Back to you for the final smiles and goodbye, David.
It's difficult. There's no easy decision. There's no easy pathway. For politicians, the choices are horrible. Public health people, the positions they have to take are often extremely unpopular. And the virus has got lots of tricks up its sleeve. I think I'm going to continue to say this pandemic could well have a 3-year or more lifetime. And that would mean that we are less than halfway through it. And that is my general feeling. It's a gut feeling. I can't give you more than that, that this has got a long way further to run. That means that I rely on you and the countless people with whom you're in contact just to maintain the general message that there are ways in which we can hold this virus back. And we've got the ability to do it, but we will lose if we give up. And I think that it's the need to continue to be steadfast and to be resolute just is more important than ever right now. Thank you very much for being with us today. Just a special shout out to each one of you. You are all, particularly when we go with a smaller group, you are all, as far as we're concerned, part of an interactive team, and we will continue working like this as long as it makes sense to all of you.